Welcome to the British Liver Trust's Visions and Values webinar. It's lovely to have you here this morning. I'm going to start off by introducing Pamela Healy, who's our Chief Executive, who's going to start us off for the webinar. Thank you, Pam. Over to you.
Thank you. I think, as we were saying earlier, it's good morning and welcome, as Sir Robin Day would say. And if you were in on the earlier conversation, you'll know what we're on about. It's really great that you could join us today. So thank you very much for coming. It's really lovely to see so many of you here. And I'm really pleased that our special guests, Andrew and Paul, are here too. And I'm looking forward to hearing from them. Jonathan, who's our project delivery manager, is going to run through some of our current activity and our latest achievements, so you can hear exactly what we're working on and how your support is making a real impact. And then our nurse manager, Rebecca, will come along to share a couple of patient experiences direct from our helpline. So she's taking calls at the moment, and so she'll join us when we can patch her in. The helpline is always busy. The theme of this session today is about vision. What is a vision and why is it important? So before we think about a personal vision with Andrew and Paul, I'm going to take a couple of minutes to start us off by reflecting on the British Liver Trust's vision, which is a world without liver disease, and how and why we as a team developed this very ambitious vision. Some would say an impossible vision. But we wanted to dream big for everyone at risk of or affected by any kind of liver disease or liver cancer. To think about the world, what the world would look like with no liver disease, where all preventable liver damage was identified at an early stage, where the damage can be reversed, where liver cancer is identified early and is treatable, and where all types of viral hepatitis are cured, and where innovative research provides us a cure or an effective treatment for the rarer types of liver disease, such as those that are inherited or autoimmune conditions. How would that look or feel? Looks pretty good, would be pretty good as far as I'm concerned. As a whole charity, when we reflected on what it would look like, it absolutely made sense that this should be our vision. We should be hugely ambitious for the liver community. It's no more than families and patients deserve. So when it comes to the hard work, deciding what we actually have to do to work towards that vision, and what does that actually look like? So for a start, we have to work in partnership. We can't do it alone, and that's absolutely certain. We have to share our vision with the liver community, and we have to create a strategy and then break that down into goals and specific actions, setting it out as a vision with goals, and then our actions bring us closer to those goals and make things feel much, much more manageable. Each step, each conversation, each project plan, and each donation brings us closer to that vision. By working with primary care and secondary care colleagues, our amazing supporters, patients and families and MPs, yes, engaging with politicians across all parties who decide health policy for millions of us, to share with everybody our vision and our values, and to bring them along with us on this journey. So now, please, I'm going to ask Jonathan to explain exactly what we're doing to help bring that vision to life, who we're working with, and the impact of our work. And then, as I say, we will grab Rebecca off the helpline just to give us a little insight of what patients are dealing with at the moment. And Audrey will lead the Q&A session with Andrew and Paul. Jonathan, you're on. Thank you.
Good morning, everyone. I'm going to run you through a few examples of the work that we've been doing recently, and give you a sort of a flavour of where we're building on what Pam talked about there. And I think sort of drawing those two real key themes, that the vision and mission guide what we do with the trust, and all of the projects that we look to consider and how we work. And that thread of partnership is so important to us. It runs across so many of our projects, and that is actually what enables us to provide such a strong voice when we're talking about liver disease, when we're talking about what we think can be improved about liver disease, and when we're supporting people who are fighting liver disease. So those are the things that I'm going to run through all of the slides that I talk about today. A very quick recap of what we actually do. We have four real important strands to our work. First and foremost, we are here with information and we're here with support. Anybody who's diagnosed with any health condition is often immediately looking for advice, for information, for detail, all those questions that suddenly come forward. And as you go through a health journey, it's invaluable that you've got trusted information that you can rely on. So we are there to provide that alongside the care that they're getting from healthcare providers, and make sure that people have somewhere they can go with any question, any request for information, whatever it might be. And that works from written information and resources on our website through to our support groups, our helpline. Hopefully there's something there for everybody at whatever stage of the journey they're at. We want to raise awareness. It's absolutely crucial that the wider recognition, understanding of liver disease and liver cancer is there. We can't make traction in these changes if we don't have that understanding. And I think that's something I'll come back to in a minute. And linked into that leads to campaigning. It's absolutely crucial that early detection is at the forefront of agendas of healthcare. And that's something with liver disease, which is even more important than some other conditions. And obviously looking to get that better treatment throughout the whole liver disease journey. And partnership gets an airing already. We are really making strides in the work that we do, standing alongside healthcare professionals to make sure that the needs of patients are at the forefront of what is going on, and also encouraging research around new innovative ways of treatment, things that can change, that can support more patients. So those are our sort of guiding principles, if you like, and most of the umbrella that our work sits under. I think this graph is absolutely crucial in showing people the scale of the challenge. When you look at this graph, the lines towards the bottom of the graph are all of what most people would consider the really big major disease issues in this country: diabetes, heart disease, cancers, COPD. And you can see that with all those lines, they're effectively stable, or in most cases going down, which is fantastic. The blue line, which is going in the wrong direction, is liver disease. And I think that is something which, when we show people this graph for the first time, absolutely focuses the mind. Deaths have more than doubled from liver disease in the last 20 years. And one of the biggest challenges, which we are always talking about, is that there are no obvious symptoms in the early stages. So many of these cases go undetected until a much later stage. And unfortunately, if you are admitted to hospital with cirrhosis and diagnosed with liver disease for the first time at that stage, then the prognosis is nowhere near as good as it could be if it was detected earlier. So, it's really, really important that early detection piece is brought forward. So that could be quite a depressing graph, but I think there is also, we turn it round as well, and we want to motivate ourselves to say, well, we want to A, change that graph, but B, we know that it is possible to change it. 90% of liver disease cases are lifestyle related. So straight away, we've got a situation there where those are preventable. And if we can educate, raise awareness, drive early detection, we can bring that graph working, in a downward slope. And obviously that's what we want to do. We want to see that change. But I think, again, what it does show is the amount of work that there is to do. And I think often there's a huge stigma around liver disease. And I think that has a huge contributory part to why this graph is not coming down as quickly as it should do. Hopefully, a lot of you have seen our recent stigma campaign. I think it's really, really crucial that in all settings, people feel that they are able to talk openly, to ask for help, and not be stigmatized around liver disease. and all the connotations that maybe have gone with that in the past. And that's something which is really, really important to us and a critical focus at the moment. Unfortunately, those trends in that previous graph have a direct impact on the rising rates of liver cancer in this country. The vast majority of liver cancer cases are as a direct result of patients who have cirrhosis. It's currently the fastest rising cause of cancer death in the UK. And you can see on this page here that, you know, there's some horrible increases in percentage rates there. I mean, that's a significant rise. And so for something with such a challenging survival rate, those numbers relate to a lot of people with a significant challenge around their health, and we want to change that. So how do we go about doing that? We've got a very much a sort of a two-pronged attack. We see it as a case of having to raise awareness from the bottom up and influence from the top down as well. Pam mentioned in her talk earlier that, you know, we have to talk to politicians. We have to engage with those people that are making those decisions that influence and decide healthcare outcomes for millions and millions of people across this country. So the top-down approach is very much about uniting the liver voice. Pam chairs an organisation called the UK Liver Alliance, which brings together stakeholders from right across the liver disease world, from patient groups through to clinicians, and it means that we have a united voice when we are talking to decision makers. And it's really, really important that that work takes place, because whichever way you look at it, if you cannot drive all of this change just through the work we do, we need policymakers, we need healthcare commissioners to understand the importance of liver disease, but also the point I made in the earlier slide, that there are positive changes that can be made. So we've spent a huge amount of time engaging with politicians and with policymakers. We have an all-party parliamentary group on liver disease and liver cancer, which has had some fantastic parliamentary debates, the first ever parliamentary debate on liver disease. We've held events on the Westminster estate. We've taken our mobile unit to Holyrood and the Senedd to actually go and provide liver scans to MPs to actually try and help them understand the ease of early detection, but also the seriousness of the condition. And we've had a huge response to all of our stakeholders around our early detection work. So that's our top-down side of things. Obviously, the other side of it is engaging with the wider population to make that awareness-raising activity as powerful as possible through social media, through our website, through some very powerful media opportunities that we've had. We've featured on BBC Morning Live with a feature with Dr. Zand coming along into Liverpool, talking to people about liver health and then getting them scanned. And crucially, and I think always most powerfully, those patient experiences. We have such wonderful feedback, and we're so grateful to the patients who are willing to stand up and bravely tell their story, because that actually is, I think, the thing that resonates most powerfully when you take that out into the wider world and somebody's willing to say, this is what happened to me. This is how I had to navigate my way through the journey, and this is why I want other people to be aware of it. So all of these things together are giving us huge traction. We're noticing more and more that liver disease is talked about in the media. We're seeing that willingness from the media to listen to the stories that are there, and that reach that expands through that is hugely important to us. So lots of really positive, powerful messages there, but it's all about interlinking that work to try and have the maximum possible impact. I talked earlier about liver cancer. So we saw those alarming statistics earlier in the presentation, and we were very clear in the years leading up to a launch in 2022 that we needed a specialist focus on liver cancer. We know that those awareness and survival rates are too low. So last year saw the launch of Liver Cancer UK, which is a part of our organisation specifically dedicated to the liver cancer field. As ever, it works in a multitude of different ways. We've got to focus on resources. So both patients and healthcare professionals have got access to trusted, medically reviewed, quality resources that can be given out to patients, or that patients themselves can access and know is reliable, trustworthy information. We've built up a network of support groups for liver cancer patients. We're trying to keep that liver cancer focus really high on the public health agenda so that liver cancer patients are getting a voice in what's going on. And that's manifested itself already with a partnership with NHS England to improve liver cancer case finding and surveillance. Again, going back to that early detection piece, whatever the situation of somebody's disease progression, it's so important that the earlier we find it, the better. And all of those things are starting to work. Again, the thread of partnership running through to develop those and deliver those outcomes. So we're extremely pleased with the progress that's been made in a relatively short space of time in that sphere. Love Your Liver is, again, hopefully something which most of you on the call are aware of. This is our mobile unit. We take this all over the country. We have a year-round message about Love Your Liver. We have a key focus in January. January is Love Your Liver month every year, where we have huge media coverage about the liver, what to do, how to keep it healthy. Again, that population level awareness message. The screener, which people can complete on our website. You see there, well over 330,000 people have now completed that screener. That's 330,000 people more who know something about how to look after the liver, who talk to their friends and family about what they've learned, and who maybe go and have a chat with their GP because they've realised that they ought to get checked out. Really important. We back this up with our public awareness events. So the mobile unit is a hugely powerful resource for us. We go all over the country, all 4 nations of the UK, and we park up on high streets, city squares, outside shopping centres, anywhere where there are lots of people passing by. And we are there to talk and talk and talk and explain all of those risk factors. You can't walk past the unit without seeing the information about those risk factors. We've got our resources to offer people, but we're also able to say to people, come on board, complete that screener that I talked about, have a scan. We have our nurses there, and we often have fantastic support from the NHS teams in the local area. People can come on board, they can have a liver scan, and they can get an immediate check of the health of their liver. And if that shows that anything needs further investigation, we can give them a letter to take to their GP and get that followed up. Thanks to the wonderful fundraising effort that helped us acquire this new unit to replace our very old and tired one, we now have a situation where we are routinely scanning over 100 people every day. We take the mobile unit out and about, and it's a fantastic impact for us. But what it also does is it says we can invite along those key decision makers I talked about earlier. We get MPs, healthcare commissioners, public health teams down, and we show them exactly what is happening on the ground in their area. And it's something which is so powerful because you can't not see the scale of the problem then when it's right in front of you. So we've had some phenomenal conversations and moved those conversations on so much more swiftly because of the ability to host these people, these stakeholders on the mobile unit and show them face to face what's going on. It's also really strengthened our partnership working with the NHS because a lot of NHS teams have now coming to us and asking to hire the mobile unit when we are not using it. So this is fantastic because in its downtime, it's still out and about in communities, directly finding people who need support around liver health. So this is really, really good. And that's something, again, that we'll be looking to build over the coming months and years. This is something which really shows the power of early diagnosis and early detection. We did a huge survey when we realised that there was massive variation around what was happening in primary care across the country. Primary care is absolutely critical because it is the interface where the vast majority of people are going to go if they've got concerns about their health. But what we found anecdotally and what we heard anecdotally was there was huge variation in what was happening across the country. So we did this survey, and the left-hand slide is the survey that we did back in 2020 and was published in 2021. And this is basically a survey of every health board in the devolved nations and every clinical commissioning group as they were then structured in England. And we asked, under freedom of information, do you have pathways in place in primary care that will react and respond to anybody who displays an abnormal liver blood test if someone's getting checked out for their liver health, and B, actually looks to proactively identify and check out people who might be at risk of liver disease. And you can see from that left-hand map, huge swathes of red, which is really alarming. Those areas of red had no commission pathways at all. Areas of yellow had a partial pathway on in development, and the green areas had a full pathway in place. What that gave us was a benchmark, and what we were then able to do was mobilise our wonderful supporters and clinician supporters to write to their MPs and say, this is not good enough, this is scary, this is not something which should be happening, in a country such as ours right now. And that sparked a huge number of meetings for us with the healthcare providers and commissioners and decision makers in those areas, talking to us about what do we need to do, how can we improve it, what are the areas of best practice, what can we learn from, and we've seen fantastic response and engagement to that. We've just completed, and this is literally off the press, the right hand side is our resurvey, which was done literally in the last 2 and 3 months. It's a slightly different boundary of map because since we did the first survey, the commissioning landscape in England has changed from the old clinical commissioning groups to what are called integrated care boards. So they cover generally a much larger geographic area. So it's not a direct like-for-like comparison, but the reason you've got the extra colour there is because some of those areas are still in transition from the old CCG structure to their new wider structure. And there are areas of good practice within there, but there are also areas where they need to do better. So we've got a different system. So sort of the peach colour is where a pathway is available in one of these new structures, but it's not yet uniformly rolled out across the whole structure. But what you can see very clearly is there is a lot more green on that map than there was, and there's a lot less red. We're not complacent about what's going on. There's a huge amount of work still to do, but the whole of Wales now has a uniform pathway. So wherever you are in Wales, you would get that same consistency of care. Scotland's seen huge improvements. And as I say, across England, much, much less red than there was. England was always going to take the longest amount of time because of the largest number of boards to engage with. But this is, again, a fantastic tool for us to go out with and use to drive change and to show directly what's going on. Research is another hugely important area. And I think, as with many things in the liver world, it's underappreciated, undervalued and underfunded. So that's something we're trying to change. We're trying to partner up with organisations to change that, to make sure there's more investment in research, make sure, crucially, that it meets patient need. And that's something that we've really focused hard on in the last 18 months. You cannot overstate the importance of patient involvement. It must be that patients are involved in the design of projects, in sharing those results, in understanding how that patient journey evolves because of the research that's going on. So we've had brilliant engagement. Our patients, as ever, are being phenomenal in supporting our work, but they are then being able to be directly involved in these research projects. Their opinions are being heard, and that is then shaping the nature of new procedures, new treatment opportunities, new methods of support for patients, which we're really happy with. Occasionally as well, we've been lucky enough to receive specific donations or grants that want to support research. We had a legacy which directly specified it wanted to be involved around a particular condition, and that is helping us to fund a research project into a quality of life tool to support people with the liver condition PSC, which is fantastic. So all of this is starting to gather pace, and it's something that we want to see grow again in the future months and years to come. Outreach and patient support is another huge strand of the work that we do. And I think, again, it's one of these things which really illustrates how everything we do has an interlocking approach. So we obviously, a huge part of our work is here to support patients. And our outreach team, who are spread across the country, hold a huge number of support groups, both online and face-to-face, which really enable patients to meet others who are going along that same journey, others with their condition. And they develop huge friendships, huge sources of support through this. And it's really humbling to see when you look in on these groups, the difference that is being made by people being able to connect with others in that same situation. We've got Elspeth's story here as a little example. You know, she's a patient who has been with our groups for a long time on her transplant journey. And you can see from the quote there that it's let her get to know people from all over the country that are going through that same situation and who've been there with her. You know, they're now people who she would regard as friends, but it's always been somebody you can say, what happened when you were going through this part of your journey? What question do I need to ask now? How on earth did you approach this when it felt so difficult? That's invaluable for people to have that. We have groups across all manner of liver conditions, including transplant, pre and post, liver cancer, young people, for carers, all of the different specific liver conditions too. And it does give that mental, that emotional support, and hopefully helps them with their physical health as well, with some of the sessions we're able to run about well-being. This year alone, we've had over 2,000 people attend those events, those support groups, and we want to double that over the next 5 years with the funding that we're looking to achieve. And we're getting closer and closer collaboration with the liver units across the NHS, where we are getting them to talk to their patients about what we do so that we can support as many people as possible. And obviously, in turn, going back and giving back so that we can be part of the clinical environment there. We can have resources and people there at the right time to support people as well. So really exciting times in outreach. Completely linked into this is the nurse-led helpline. I've talked a lot in this about partnerships, and obviously some of those are external and a lot of them are internal as well. The whole patient support journey can run from somebody wanting to have a piece of information from our website, a quick look on a fact or an update, downloading a publication, information sheet, going to a support group. But I think what underpins so much of this is our helpline. We have a small but phenomenal team of hepatology nurses, all with different backgrounds in the NHS and medical experience. And what they offer is the ability for anybody to pick up the phone, call them, and talk about what is happening. I think for patients to be able to do that, for carers to be able to do that, for friends of anyone who's worried about someone to be able to do that is absolutely invaluable. And the feedback that we get from the callers absolutely shows how much value they do place on that. Since the pandemic, demand has gone absolutely through the roof. You can see the stat there of over 5,000 inquiries a year via phone and email. It's everything from simple questions right through to crisis, palliative care support, telling people what questions they need to ask their medics, whatever it might be. And I think, again, that the call times reflect the massive breadth and depth of what is being asked of our nurses when they come in. We want to do more. We want to support more people. And I know that Rebecca, our helpline manager, is dropping into the call in a moment when she's off her current helpline duty, so she can give you a little bit more information about the helpline itself. But I think that just demonstrates that when somebody needs to contact us, we've got every different opportunity of them to be able to do that. And hopefully we can meet whatever need that they've got at that particular time. So in summary, the partnership word has flowed throughout this presentation, and we cannot achieve our vision without that. We are fighting an enormous challenge. The liver disease and liver cancer work that we are doing will take time. We're not under any illusions that this is a significant long-term project. We're not going to turn this around overnight, but we are, through these partnerships, seeing significant progress, and we see change every day that we come to work. And I think that's hugely positive for us. We have, it's almost become a bit of an in-house joke, but we do make sure in a serious way as well that we do stop and look back, because we are so busy. We are a very small team for the size of the challenge that we face. But thanks to the work of the Trust and the staff at the Trust, alongside our supporters and our partners, we are making enormous progress on a number of fronts. And I think it's really important that we do look back and we take motivation and pride and redouble our efforts through what we do see, the progress that we're making. We are here for the long term every day, because we know that what we do and what we provide is essential to people on a daily basis. And I think my summary point would be that whether it's campaigning, whether it's providing support, whether it's driving change, our supporters, the people that are here on this call, are the people that enable us to do that. And as a team, I know that I would speak for everybody at the Trust when I say that we gain enormous encouragement, motivation and drive for that, because every time we look back and we see the difference it's made for somebody, or we hear somebody say, without you doing that, I wouldn't have had this, or just a simple thank you, all of those things are actually what keep us going day in and day out. So we are immensely proud as a team to do what we do. And we're immensely proud to be working alongside all of you to do that. So I hope that those slides have given you an up-to-date overview of where we're at the moment. And I will stop sharing there. And I will hand back to Audrey momentarily.
Thank you so much, Jonathan. Thank you very much indeed. And I'm delighted to say that Rebecca has joined us straight from the helpline. So Rebecca, if you'd like to just share your little session for us now. Thank you.
Oh, thanks, Audrey. And thanks to Jonathan for such a brilliant overview. I only jumped on at the last minute. So, but I think I heard, absolutely fantastic bit at the end. So thanks for that. It's lovely to see everybody here today. I'm Rebecca. I'm the nurse manager at the Trust, and I manage our nurse team. There's 6 of us. We're all part-time. And as Jonathan said, we cover the whole spectrum, really, of liver disease, liver symptoms. We've all been nurses for many, many years. So it's really great that you've all come here today to hear about our work. Thank you. I'm going to have to make it quite short and sweet because it's only Kirsty and myself on the NurseEd helpline today covering the whole of the UK, and we're busy. We're really busy. So we have had a fantastic year. It's been amazing. Like John says, we are just getting busier and the demand is there. I've just been looking at our statistics for our service, and amazingly, we've answered 44% more calls this year compared to last year already. I think I have some grey hairs to show that. So I wanted to really talk to you and give you 2 examples that kind of illustrate what we do and the impact of what we do. So I had one example ready and was thinking about it this morning. And actually then typically I was on the helpline with Kirsty today, and I've just spoken to a gentleman, and I just thought it'd be really wonderful to share that with you. So this chap has a diagnosis of advanced cirrhosis, so advanced liver disease. And he was really, really struggling to access his medical team. So really struggling to access his GP and his liver specialist. As we know, the NHS is in crisis. So he called me today very upset and really tearful because he's starting to show symptoms of more advanced disease, and he didn't really know what to do. So he was yellow, he's jaundiced of the white of the eyes and of his skin, and his tummy's swelling quickly, and it's quite hard, and it's pushed out his tummy button. And he's very, very upset and worried about what to do. So we kind of talked through things in different stages. And I always say, if you've got a pen and paper, go and get a pen and paper. And so then we have 3 bits of paper in front of us with things that maybe we need to manage today, talk about managing today, things that can maybe be managed the next couple of weeks, and jobs for the future. And really today was about accessing quite urgent medical help. If somebody's jaundice, that's a sign that your body's really struggling. And if the jaundice has come on quite quickly and combined with other red flag symptoms, then those are all symptoms that this gentleman really needed to be seen today. So we talked about ways to access that, because not everybody knows how to be seen quickly. And he didn't know. So he had asked the GP very politely, and we sort of talked about ways that he can maybe escalate that as a cause for concern. And he was just really grateful. He said, "You haven't judged me." Well, of course I haven't judged you. But I think lots of liver patients do get judged. And, I spent 26 years of my life fighting against people being judged in liver disease, because it's just completely unnecessary. So we talked about that. And I think he was just really delighted to have some time with somebody who really wanted to help him. And that's what we're here for. So that was great that we could have helped this chap this morning. And then I was thinking about another example. And this is a really lovely one to share, because this is a lady who my team and I have supported for 2 years on and off. And her husband was diagnosed with autoimmune hepatitis, which is a condition where your body effectively is fighting itself. And unfortunately, he has now got more advanced disease as well. So his disease is progressing, and the couple have found that very challenging, obviously. And they often talk to us. I tend to speak more to his wife. And she spoke to another one of my nurses and said, "Can Rebecca call me back?" And I was thinking, oh no, I was really dreading, thinking that there was some bad news. And I called her back and she said, oh, I wanted to talk to you back because we've just found out that hopefully my husband's going to be listed for transplant. And she said, after calling my girls and my daughters, you were the next people we thought of. And so I thought, I mean, how amazing is that? That's just incredible. I thought, really? Wow. And I think what it gave that couple some hope on the horizon. And that's what we all need. So nobody knows what's going to happen to that gentleman. But I think what's really important is that we will support that couple throughout their journey, whether that's transplant, whether that's going to be managing and maintaining him, or whether or not that will end up being end of life. We will be there for that family throughout the next stages of their journey. And we're finding that we're supporting people much more in different ways and in longer term ways, because, you know, as I said, it's hard to access the NHS at the minute. So I hope those two examples are useful and they illustrate what we do. It's a real privilege for my team and I to help people and to be there in their time of need. And without the support of donors and fundraisers and people like you all, then we really couldn't do our job. So thank you.
Thank you so much, Bex. Really lovely to see you. And I know, like you said, it's just you and Kirsty on the helpline today. So you'll need to head off in a moment once the calls start coming through again. Thank you. But thank you for sharing that. Any questions or comments from any of the speakers today, do pop it into the chat box and then we'll respond to those as and when we can. Thank you. We're coming up to sort of 11:45, so we're going to have about 20 minutes or so now as a little Q&A session with myself, with our guest speakers, Andrew and Paul. So I'm delighted to welcome them to the webinar. We've been working with Andrew and Paul probably, it's about 2 or 3 years, isn't it now, Andrew? That we met each other at an event, and an online event. Nobody met in person at that time. But Andrew and Paul have expressed interest and support for the Trust. And I want to express my gratitude to them, but they've done everything that they're doing for us and with us is pro bono. So Andrew and Paul have their own businesses. They're very busy chaps, and I think they could probably demand quite high fee for their services, but they give everything to us for free. So I just wanted to say a huge thank you. So much so that they're extending their support, and they have already extended their support to our supporters. Roy is with us on the call, and I'm going to bring you in a few moments, Roy, to sort of talk about your experience, but you've worked with Andrew as a result of attending a webinar a couple of years ago. So Andrew and Paul are very kindly giving us their time for free and offering to help and support our supporters. But we're here today to talk about visions and values and kind of how you two guys work. We're talking about planning, we're talking about planning and preparing, but you go about it kind of a slightly different way from what we might imagine a traditional financial advisor would do, which is that you don't really talk about money, that you start from quite a different place. And I wondered if that's something that we could start with, if you could talk, Andrew or Paul, I'm not sure which one of you is going to go first, but thank you, Paul. Just a bit about your approach and how you are different from traditional financial advisors in the context of visions and values.
Thank you for the introduction, Audrey, and it's been brilliant today so far to listen to the work that's been done. In answering that question, I suppose historically financial advice focus on money.
Sorry, we had a hiccup on the recording, but we're back on track now.
No problem. I'll start that again, but yeah, thank you. Historically, financial advice has been very money focused, and has been delivered really with the attention mainly on the money, mainly on products such as pensions, ISAs, investments, etc., without any real purpose, apart from I want to save some money or I want to invest some money to get a better return, etc. And we think the best return possible from a financial advice process or a financial planning process is return on life or a return on legacy. So really, the major difference with what we do as a practice and what Andrew does in his role, it is to really focus on the person, on the human side. So we always start there. It's about asking people what their real values are, what's important to them, what they want to do with the rest of their life, what they want to happen when they're no longer on this earth. But it's really digging deeper about the purpose that they have for them, their family, and then understanding what the purpose of the money is to help them achieve what they've shared with us. So that's the real difference in terms of what we do and what I would call high quality financial planning is about compared to financial advice, which is, as I said, very centered on the money, not the person, if that makes sense.
Yeah, absolutely. Thank you. So just to explain a little bit about why it's not all about the money, go into that a little bit more about that values. Why is that important to get to know that person and thinking about the values that are important to them?
I think because if we don't ask good quality questions and really get to know someone, we could send them completely down the right path particularly in our recommendations and advice. If it's not aligned with their money's not aligned with their life and their values, it can be completely off track, and we won't really build a trusting relationship with them. Yeah, I think that's a fundamental part for us. And I think I had a new client yesterday, and when I asked about what's important about working with a financial planner, it was she would want to work with one where she couldn't be open. Yeah, and that means if the trust hasn't been built and the real relationship hasn't built, you're less likely to get a real good outcome from that relationship. Yeah, it might be okay, yeah. It might grow your investments, etc. But it really won't develop something that's really meaningful over time, and is less likely to achieve what an individual or a family want, both for their lives and for what happens after.
Okay.
Yeah. So as an example, if charity is really important to a client, and that will come out in a conversation where we're paying attention to the human being and not the money. Yeah.
Yeah.
And then if that's really important for them to be doing something in their lifetime, or for them to leave a lasting legacy in their within their will, then if we focus on talking about investments and products, etc., it's less likely that we're going to get to the crux of what's really important to them.
Okay, thank you. Andrew, I know you've been working with Roy, haven't you? Do you want to say a little bit about that, and then we'll bring Roy in to sort of talk about it from his point of view? Do you want to sort of say how that relationship started up and how it's been working?
Well, it started because Roy attended a webinar, and Roy did one of the good morning, Roy, by the way. And Roy did something that a lot of people don't do, so he followed up, and we're going to talk about this a little bit later. So he made contact. He then took that. And that's the most difficult thing, I think, where somebody reaches out and says, look, can we talk? So we talked, and we spent a fair bit of time, as Paul says. Let's look at this individual. Who is this person? What's the point of trying to recommend a product when you don't even know the individual, or what their circumstances are, what they value, what their beliefs are? And we spent a fair bit of time with that. And then you find out through that relationship, as Paul says, where the trust builds, the relationships builds, they will open, and you'll find out, why are these things not being done that are important to you? And you find that out, and then you break those barriers down. And one thing just to add, which is obviously the significance between British Liver Trust and what we do. When you look at the management of wealth, and when you look at lifestyle planning, legacy planning, when you're not doing those things, there's no symptoms either. There's nothing to say that there's something wrong, okay? And that you won't find any symptoms until the day comes when you realize that, whoops, I should have done this, and I've not done this. And now, personally, financially, I'm in a bit of bother. So we're faced with the same thing, really, which is let's look at those symptoms and let's try and find them before they become a real issue and a real problem. And most people equally, Roy had a vision-ish, and he'll no doubt talk, but it's let's get that kind of let's get focused on that and exactly what it is, because if you haven't got that vision right, you can't pass that on to the people that can help you with that issue. You can't do it. So nothing gets done. But if you can kind of spend some time, get to grips with what is the vision, what is it that this individual or company or whatever wishes to achieve, and then build a team around that, you can actually get things done. And in Roy's case, we managed to get a few things sorted, I would say.
Okay. So it seems like a good time to ask Roy to say a few words about how what was it that motivated you to contact Andrew and then take that step, and how has that been for you?
Yeah, it's been very good. As Andrew said, it all came about from a webinar for actually signing a petition with the Liver Trust about demanding, liver cancer be looked at in more of a way, and then that led to the webinar I attended, which we're all attending today, and it was it's been a great journey. When I first attended, I've been to a lot of seminars, and they got very confusing. They got extremely confusing. I was attending many of them, dealing with estate planning, wills, lasting power of attorney. Unfortunately, I found it all very confusing, as I found advice from one seminar to another. I attended continually, it just contradicted one another. And this left me very confused, especially in knowing who I could trust. Then what naturally followed was me to bury my head in the sand, refusing to engage in any legacy planning whatsoever, thinking I will deal with this some other time, even though I was very aware that if something were to happen to me, my personal legacy would have evolved from law, complete strangers deciding who benefits my estate according to certain criteria within, I think it's called intestacy rules. So through the introduction from the British Liver Trust, I joined the webinar as we are today. And this was my first introduction to Andrew, and the first introduction of the concept of leaving a meaningful and lasting legacy to my beneficiaries. And just one thing during the webinar is if you please do take the time to contact Andrew, because during that webinar he caught my attention. It's caught my attention ever since. It's something I'd not experienced before concerning estate and legacy planning. Andrew had just the right approach I was looking for, something I've been struggling to find for some time. He always takes the time to listen and understand what is important for his client. And one of his many attributes was the ability to make things simple and understandable, even initially when they seem so complicated and overwhelming. And Andrew will probably giggle at this, but sometimes I tend to make things quite complicated, overthinking, trying to plan for every little detail, which obviously you can't do in these types of situations. Again, this is where Andrew's skill sets came into action, and respectfully, through further conversation, he finds a balanced resolution to all the concerns I had and a way forward. Yeah, I'm forever grateful. This has enabled me, and I would encourage others to start the process of creating my own personal lasting legacy derived from my own values, my beliefs and my wishes, leaving a meaningful life story that can be handed down to the next generation, not just from a financial perspective, as we've been talking about, but also a lasting legacy that is consistent with my core values and the wisdom that I've obtained over many years. So one other thing I liked with Andrew, the way we address it, whether he does it with other clients, is one of his concepts was to begin to focus on what you do not wish to happen rather than what to happen, which was a great starting point. And that led us to move forward and start making some plans. Since then, we've had several conversations. He said he met with my financial advisors. We actually had a big meeting with a solicitor as well. And now I have a lasting power of attorney along with a personal lasting legacy, which we're still working on together, and that will be handed down to future generations. And hopefully that will be influencing my beneficiaries with my wisdom and my core beliefs. So in conclusion, I just can't think.
I think that's really interesting, Roy, the thing that you said about think about what you don't want to happen.
Yeah.
Because some people struggle with that, take that first step. Well, I don't know what to do or how to plan. Well, think about what you don't want. And I think probably we generally agree that we don't want the state to decide what happens. That's probably the first thing for most of us. But then thinking about what you don't want, and actually if you haven't written down what you do want, then some of those don't wants are likely to happen. Was that a bit of a light bulb moment when you thought about that? Oh, actually,
that was a big light bulb moment. It just began. It really started the process and going. And that was Andrew's ethos with me, and possibly it is with other clients. But yeah, it was, because I do tend to try and plan for everything, but really the main thing is to plan for what you don't want to happen, so that you can this life legacy that you can leave for others. Because we gain so much wisdom over the years and things like this, and it's just amazing. And Andrew just seems to have a natural gift of bringing it out of people, I think, as I saw on the webinar and as I've seen in sort of personal contact with him. It's I can't thank him enough, and for the British Liver Trust to introduce me, because it has been a confusing and overwhelming journey, which Andrew simplified, which is amazing. And we're still working on it. It's given me thought. Sometimes our families are not as easy as others, and there are complications with that. But Andrew's made me see a way through different things. And one of the other things that I love about it is that coming together with your beneficiaries, with your charities, finding out what their core values are, what they want, so that you can actually, from a financial point of view, or even as a volunteer, that you can leave it your legacy in that way. And I think it's a great point that he made me aware, which doesn't go on, as he said, with financial advisors who seem to be money orientated generally, is that to meet with your beneficiaries before your passing is to talk about your will, talk about your legacy, talk about your values and how you'd like to see them use things that you're going to leave from them and things like that. And because it's such a difficult process to go through when someone does pass, and families have to come to terms with, look what the legacy is. And when it's a surprise, sometimes the surprises aren't good for everyone. So I think initially, and Andrew's taught me that, and that's still a process that I'm working through now, is that come together, sometimes to bring them all together in one room. That was something idealistic thing, which would be amazing, to get everyone in one room and say, look, this is what I'm about. This is what I want to happen on my passing. And this is what I've put down that I wish to happen. Amazing.
Yeah, thank you, Roy. I really appreciate that. And I think it's there's a couple of things in that. It's kind of the getting started, isn't it? And I know, Andrew, you've said that before to me, and again today, is like the most difficult thing that people have is like, how do I get started? I liked the way that Rebecca described how she helped that caller today with the 3 pieces of paper of the things to do now, today, things to do in the next few weeks, and then the longer term planning. And I like that idea of kind of chunking it up into 3. And it is that first step, isn't it? If I'll just bring Andrew back in again. So what is it that people find most difficult, and how do you help them through that difficulty?
Okay, I'm going to ask Paul to answer that, but only very quickly, just to come back to Roy. Thank you for that, Roy. It's much appreciated. But as a little bit of mutual congratulation, I guess. You see, Roy makes the point that I listen, which I will. But equally, Roy listen. And the thing, when you build a relationship with somebody, it's a case of you both have to really listen. And then somebody has to take some action, because eventually the listening has to stop, or the talking has to stop. So what are we going to do? And just make it nice and simple. Just do this, then do this, then do this. So people like Roy are very good to work with, because at least they take on board what you say, and then they do something. And that makes our job a lot easier. So I'm going to just hand over to Paul. Myself and Paul share the same values. We have the same moral compass. We work in the same way, and that's why we work together. So I'll just let Paul answer that next question.
Okay, thank you. So it's about getting people started. Yeah.
Yeah. Again, just to reiterate that, Roy, that was a fantastic description of it, and I'm really glad that's worked out for you. So, and you mentioned simplifying there, and that's one of the most important parts of our role, because this is all can be overwhelming, can be complicated. And that's just the world of finance. And like Roy said, all of the stuff that you hear we live in a world now where we've got information overload, touch of a button, and it's trying to narrow that and focus people around if we understand them and what's important to them. So in starting working with a new client, we invite people to have an initial conversation. And most people don't get to have those conversations with other professionals. They probably don't have it with their solicitor, or their financial advisor has been focused on their pension or ISA, or their accountant. So we're in a very privileged position that we can have these conversations with people. So that initial conversation where listening has been mentioned here, our job is to ask questions and shut up, and ask good quality questions and give people the space for them to express what really matters to them. So that's how we start. And if they like us, we like them, we feel that we have a working relationship, we'll dig a bit deeper and we'll have a discovery meeting with them where we'll kind of try and align everything that I've already mentioned, plus their money, to understand where they are today. Also understanding where they've come from, who they are, as Andrew mentioned. So a little bit about their past. With some new clients yesterday, and I was asking them about their first, if they could think about what they learned about money from their parents or from their grandparents, which is the legacy that they've left in some respect. What is that? Because how do they make decisions now is probably from what they've learned from the past. Yeah. So that's getting to know them, and just really understanding their whys and their whats, but trying to simplify this down. And overwhelmingly, there's so much information, as I said, or so many things that could be covered, and you can't do it all at once. As Roy's expressed, it takes time. So it's trying to help people just come up with what really matters most to get on with now, take some action on now. And we actually turn it into a one-page life and legacy plan that we've been working on a lot more recently as well. And this is all ever evolving, ever improving. But it's to try and get things down to here's all the detail, but here's one page which confirms what's important to you, your values, your life's purpose, your legacy purpose, and here's some actions that will move you forward. And then working with people over time. It's about relationship, because we need people to help them stay on track for them and their family. Yeah, and the next generation, as Roy mentioned. Yeah,
definitely.
No, can I just add something there, Audrey?
Yeah, of course.
Very quickly, going back to one of the questions, what makes us different? What sets us apart? And a couple of things really. Paul's probably too modest to mention, but he got an email yesterday, I think, and Paul is on a shortlist for the Lifestyle Financial Plan of the Year in the UK, and there's only 6 on that shortlist. So anybody wishing to work in that way. Well, indeed. And I pat him on the back, but he doesn't always pat himself on the back, which is nice. But that means he's one of the top 6 in the UK, if not, in my opinion, the best anyway. But the other thing about that question is that we look at a lot of financial advisors continually focus on what's called funds under management. In other words, how much money have they got? How much money they bring in. We focus on relationships under management. How many relationships have we got? Quality relationships, and how do we develop those relationships? And then we find that business, to a great degree, takes care of itself. And there's a big differentiator in that. And I think Roy's been on the receiving end of both. And when you are, you realise the differentiator. You realise that one is completely different from the other. That's what sets us apart. Yeah. So just to add to what Paul said.
Yeah. Thank you. Well, congratulations, Paul. When is the final and announcements and things? When will you know?
Wednesday there's a conference in Birmingham. Yeah, it's called Back to Why, which is back to you, more about you as a person. So
wow, congratulations, that's amazing. It's really good news.
Thank you. But one last point I just thought, vision, really. It's we were talking about vision earlier, and it's helping people to really create that simple vision or as complicated as they want it to be. But that vision of what does, an authentic life, a successful, purposeful life look like, and align their finances with that.
Yeah.
And the lasting legacy is a real big part of that. And there are some tangibles as well, obviously tax savings, etc. People leaving money to charity, which we can talk about on a one-to-one with anybody. But yeah, that's part of the legacy, is what you can do. And a big part of it is the social legacy, really, of what you can do. And it's why we're all here today talking on this platform.
Absolutely. Thank you. I've got just a couple of things. I think Dan is going to share a link to the Hereditas website into the chat box, and then we'll follow up on emails as well. Just to remind people that if you're happy for us to share your email address with Paul and Andrew, please do let us know, and then they can contact you direct. Or if you want us to put you in touch, come back through myself, Dan, or Tam through the fundraising inbox and so on. But we'll follow up with you next week. And that absolutely you've offered this service, which is really lovely, for our supporters to talk to you for absolutely no fee. So make that very clear. I just wanted to share, if I may, that there was a lady that I had hoped to come along today, and I spoke to her yesterday, and that is the daughter of the founder of the British Liver Trust. So Andrew, when we first started talking, 2, 3, 4 years ago, Andrew was very keen that we share the story of our founder, which is Dame Professor Sheila Sherlock, who I sadly never met. She's passed, but she, in the words of indomitable, formidable, innovative, everything for this woman, because she was a female hepatologist in the world of very, very male dominated health service back in the day. And her daughter, Amanda, it's her birthday today. So I did speak to her about coming, and bless her, she said, "Oh, I could change my arrangements." And I said, no, you're going for brunch and it's your birthday. Please don't come. But she was born this day, 1958, and her mother was the president of Basel, and Pam will know what that means, the British Association for the Study of the Liver, and it's their conference next week. And at the time, Dame Sheila was the president of Basel. So she, for Amanda's coming, her birth, she booked a cesarean for 2:00 in the afternoon. In the morning, she did her clinic for her patients. And at 4:00, she was back at her desk signing her letters to her patients on this day in 1958. And baby Amanda was 2 hours old, and her mother was back at her desk signing letters to patients. And that just shows you the world that she was working in. And we've had the joy of meeting Amanda. She came to an event that we had last year. She got back in touch with us, and she's supporting the charity. And today she's doing a Facebook fundraiser for us, because she's obviously a modern woman and we do our stuff on Facebook now. And she's also got a coffee morning for us, and she's doing lots and lots of promotion. And she said, everywhere I go, I'm talking about the British Liver Trust. And she remembers a childhood of through the 50s, through the 60s, of kind of looking through the banister at this household full of professionals, hepatologists. Her father was a scientist. It was a very busy household. And she can look back clearly and see that this charity that her mother created is going from strength to strength. We have this big vision, and she's still part of that. And that legacy, to me, I mean, it gives me goosebumps to think that we're, in touch with the lovely Amanda, and it was her mother that enabled us to all still be here today. So what a fantastic legacy.